Interactive for subscribers. Discover a treasure trove of ancient knowledge. This channel features a series of 248 videos dedicated to amazing healing methods preserved in the Jewish tradition for centuries. Each episode is a separate story, a rare recipe, and a secret that opens the way to health through the wisdom of ancestors. 248 unique healing methods, tested by time. Each video reveals one technique, explanations, and tips for a modern person. Interactive for subscribers. Invite 10 friends, organize 10 likes, and get the opportunity to learn how to turn a method of treating an illness that interests you, not yet published. Leave requests for individual topics in the comments to the video. Every Monday, the channel releases a special video dedicated to the joint reading of Tehillim, Psalms, where all subscribers combine their intentions and requests for support, help, and healing for themselves, loved ones, and the whole world. May sincere prayer and ancient wisdom guide you on your journey to health and harmony. Join us to discover the secrets that have been kept for centuries and become part of a unique community where tradition meets modernity. 248 Secrets of Jewish Traditional Medicine, JTM. JTM. Treatment, Panaritium. Healing secrets from the diaries of Mindcesters. Panaritium, also known as felon or whitlow, is a purulent infection of the fingers, often affecting the nail bed or surrounding tissue. It usually occurs due to minor injuries or improperly treated wounds that allow bacteria to penetrate the skin. Symptoms include pain, redness, swelling, and the formation of pus. Modern treatment may include antibiotics, warm compresses, and in some cases incision and drainage. The history of medicine is full of examples of knowledge and experience being passed down from generation to generation, enriched and improved. For some families, medical practice becomes not only a profession, but also a part of family identity, a source of pride and special traditions. I belong to such a dynasty. More than 4 generations of my ancestors have dedicated themselves to serving people's health. During this time, our family has accumulated a unique wealth of knowledge, including rare methods that have not found wide distribution in mainstream medicine, but have proven their effectiveness in practice. A medical dynasty is not only respect for the profession, but also a constant exchange experience between generations. Each new doctor in the family, receiving basic medical education, is sure to get acquainted with the experience accumulated by ancestors. Unusual clinical cases are discussed, diagnostic methods are analyzed, old recipes and methods of treatment are studied, sometimes preserved only in family records. Over time, approaches to treatment change, new technologies and drugs appear, but the value of practical experience does not lose its strength. Sometimes it is family secrets that become the key to recovery where standard methods are not effective enough or are associated with high risks. Panaritium, the problem and the traditional view. Panaritium is an acute purulent inflammation of the finger tissues, often occurring as a result of injury, splinter, or cut. This can be an injury at work, an injury at home, or just cuts and injuries when visiting a manicurist. Modern medicine offers surgical methods for treating panaritium: opening the lesion, drainage, prescribing antibiotics. However, any surgical interventions, especially with minor lesions, can be associated with pain, risks of complications, long-term recovery, and even dysfunction of the finger. In our family, a unique method of treating panaritium is known, which in some cases allows to avoid surgery and speed up the recovery process. This unique method, along with other knowledge and methods, was passed on to me by my ancestors as part of the family heritage, emphasizing its effectiveness and safety when used correctly. My ancestors are doctors for many generations. They participated in scientific expeditions to Jewish towns in Ukraine, Poland, Germany, and other European countries. They wrote down the acquired knowledge in their diaries. Based on these diaries, videos of my YouTube channel were made. Ancient technique. The essence of the method is very simple. Immersion of the affected finger in alcohol, for a certain time. Alcohol has pronounced antiseptic, anti-inflammatory, and analgesic properties. It is important to use alcohol in a certain concentration to avoid skin burns and increased inflammation. It should be taken into account that the penetration of alcohol into the depth depends on its concentration. A preparation. For the procedure, 30% medical alcohol or a solution of another pure ethyl alcohol of the appropriate concentration is used. The affected finger is, if possible, pre-cleaned of dirt. Carrying out the procedure, the finger is immersed in a vessel with alcohol so that the inflammation site is completely covered with liquid. The exposure time is up to 45 minutes, The procedure is carried out 2 to 3 times a day. Usually the inflammation process stops immediately after the first time. Mechanism of action: alcohol effectively kills most bacteria, prevents the spread of infection, and reduces swelling. This leads to pain relief. Completion: after the procedure, the finger is gently blotted with a sterile napkin and, if necessary, a dry bandage is applied. Advantages of the method: a minimal intervention, no need for incisions or other surgical manipulations. A comfort for the patient: the procedure is virtually painless and can be performed at home. A rapid relief of inflammation and pain. The risk of complications and scarring is reduced. Limitations and precautions. Despite the high effectiveness of the method, our family has always emphasized that self-treatment is only permissible in the early stages of Panaritium and in the absence of signs of deep tissue damage, for example, severe swelling, limited movement, fever, purulent discharge. If the condition worsens, severe pain appears, or an abscess is suspected, you must immediately contact a qualified doctor. Our other family secrets and approaches. Family practice is not limited to just one method. Over many years of work, doctors of our dynasty have collected other secrets, including, for example, a use of special plants analogues of antibiotics, a recipes for homemade ointments to speed up healing, a how to prevent and permanently get rid of bronchitis and to reduce swelling, a special breathing exercises to support the immune system, an effective treatment of edema of the shins and hemosiderosis in the elderly, an effective treatment of various skin diseases, an effective treatment of various diseases and injuries of joints and bones, and much, much more. All these methods have been tested in practice and have proven their effectiveness in combination with modern medical knowledge and approaches. Continuity of generations gives the doctor not only knowledge, but also a special worldview. The doctor develops respect for the patient, attention to detail, the ability to see the disease as a whole, and not just what is written in the textbook. Family upbringing in a medical family forms in the future doctor responsibility for every decision, the desire to seek an individual approach, and the desire for continuous improvement. The secrets passed down in our family are not just a set of recipes, but part of the culture of caring for the patient's health, where the person comes first, not the disease. The experience of generations helps find solutions even where standard methods are powerless or associated with undesirable consequences. It is important to remember, not a single, even the most ancient and proven method, replaces a timely visit to a doctor and a professional medical examination. Family secrets can be an addition to therapy, but not a replacement for it. Let the experience of our ancestors and modern knowledge help us be healthy and take care of ourselves and our loved ones.